Hi, I'm Dr. Julie Steinauer. Today I'm going to talk to you about a topic that I'm sure you probably would not ever expect to hear from an eye doctor. We're going to talk about feet and what on earth a flat foot has to do with your vision. Now, before I go into talking about this, let's tell you how you can connect with us. If you're local, give us a call at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, and you have one of two choices there. You can either fill out a questionnaire, which is, by the way, revised, all new, and totally awesome, so check that out. Or you can also schedule a consultation with me if you just know that you're ready to talk with me about how we might be able to help you. Now let's go back and talk about flat feet. What on earth? I want to tell you, the inspiration for this came today whenever I was getting ready for work. And I got to thinking about various things that kind of caused me to go down this pathway. But did you know that oftentimes, and most often, a flat foot, which is the arch of the foot, is not very arched, it's actually kind of flat like this, does occur because of a condition called exotropia. Say what? So a form of strabismus where the eyes tend to not line up straight, but they tend to go out like this, causes a flat foot. Did you know that? And the reason why, here's what happens. Whenever a person has eyes that don't line up straight and one tends to wander out and away, and maybe they alternate and flip between the two eyes, the reason why this can happen with the flat foot or flat arch is that as they kind of alternate between the two eyes, they tend to have a foot pattern where they walk with their toes pointed out, kind of like a duck walk. All right, now this is really important to distinguish because if you're doing this, you've done this for a number of years, you know, you can potentially cause some problems with your knees, with your ankles, with your hips, up into your back, and could cause a lot of issues. So if you're catching this earlier, the better. But obviously, even if you're a little bit older and catching it, could be really beneficial to helping you maybe decrease your chances of arthritis. So Again, what on earth is vision having to do with this? So this condition called exotropia, where the eye tends to kind of turn out and does not align straight and look straight ahead, but one eye tends to be kind of pointed out off to the side, will tend to cause people, again, to put their feet planted outwards. We call this a pattern of duck walking, okay? Now we're not trying to make fun or poke fun at this, but it tends to be a toe pointed out kind of a walk. And what occurs is over time of doing that, because you're putting so much pressure on the balancing system of your foot to maintain stability of your whole body and your body weight, it causes the inside of the foot to kind of curl down, and that will tend to cause the arch of the foot to flatten out. So it's very common for exotropia patients to have a flat arch or a flat foot. So what do we do to correct exotropia, and can that make a difference with the problem with the flat foot or flat arch? Well, it absolutely can, and here's what's interesting. Our program is 2 phases. It is a program that first starts off with syntonics, and syntonics are those light therapy goggles I show you often in lots of my videos that we use to kind of electrically reprogram the brain how to process vision. Well, there is a specific filter that we utilize for patients who are exotropia or have exotropia, and it signals the muscles of the eyes to be able to help tell them to align more straight. Why is that important? Well, if we can get the eyes to align more straight, then it sends signals from the brain throughout the entire body, coordinating the legs and posture and everything, and potentially those little toes that are pointing out might start to come back in straight. Now, if it's a real problem and the individual corrects the vision where they're aligned with their eyes, then they're no longer considered to have exotropia, but they tend to still walk in that outward pattern with their toes pointed out. They may require to have some physical therapy to help strengthen the muscles on the inside of the legs to pull the legs back in to position so that they're not walking out. Maybe it's actually the muscles on the outside of the legs too. There's got to be a balance between the outer muscles of the legs and the inner muscles to kind of pull the eyes into, pull the legs into alignment to be more straight. When we do that, then there's lots of options that are available to someone who has a flat arch or a flat foot. Obviously, there are things like special shoes or insoles, but there are exercises and activities that you can do to try and strengthen the arch and take it from a flat foot back up to an arched position, which can not only help overall posture, can help with the ankle, can help with the knee, the legs, the hip, the back, all of that. That can, over time, kind of have some problems and break down with wear and tear of this unusual position and pulling on the posture system for the entire body. So again, bet you never thought I'd be talking about foot support, and neither did I, but I do try to come up with cool and new and interesting topics of things to talk about, because I think that partly what you want to know is you want to be educated more about your vision. And this is just another piece. You might wonder, why do you have back pain? Why do you have all of that? And it could be simply because you have flat feet and toes pointed out, and that could come and stem from your vision. Now, for more information about and how to connect with us, you can go to our website at visionforlifeworks.com. On that page, you've got two options. We want you to either, if you're not local, click on the schedule a consultation to figure out a time to talk with me about how we can help you with your vision. Or if you're not ready for that step yet and that seems a little bit too bold, then fill out the questionnaire for us. You'll get lots of cool information on that because that's newly revised and has some cool new things with it. If you are local, call us at 618-288-1489. And obviously we're on social media, multiple platforms, so you can find us on LinkedIn, Facebook, YouTube, Rumble. And if you like the video, hit that like button, hit the subscribe button, and make sure you subscribe to all of our videos so that you can see everything we put out. Thank you.